Dr. Sabo. Today we're going to talk about stretching, which is one of the workhorses of keeping myofascial pain under control. And it's something that you can do at home. Now, the stretches that I'm going to show you are ones that I like to do for a patient so that all of the muscles associated with the area I'm stretching can relax at the same time. And if you kind of do it on yourself, there are some muscles that are going to try to help compensate and support what's happening with the muscles that are being stretched. So we're going to walk through some of those things that we do with patients in practice so that you can do them at home. Now, my helper today here has long, beautiful hair. We're going to have her put her hair up, okay? What that's going to do is that's going to help to keep away from getting pulled or pinched or stretched during the exercises themselves. So she's just kind of getting up here. Perfect. We're going to start with a simple side motion here first. Now, when I'm helping to hold onto the patient's head, I make sure that my fingers are not pushing on the lower jaw. Because if you see here, that moves, right? Now the maxilla here, okay, and the rest of the head here doesn't move. So I can hold on to it without putting pressure on maybe areas that are tender. Okay, so you want to go ahead and hold right here and don't cover up the ears because then they can't hear you. And they're going to play a role in this too as well. So she's going to go ahead and hold underneath the sides of the chair. Okay, she's going to have her feet comfortably on the floor and her shoulders are going to relax. And she's going to allow me to do all of the movements, which for a lot of patients, it's hard to do when you first start this because you're so used to protecting these muscles that are sore because you know they cause you pain. So you'll hear me kind of reminding her to relax as we go. Now, when I start into the stretch, I have complete control of her head, so she's relaxing everything. When we get to the point where she feels like it's really kind of getting tense for her, she's just going to make a little noise, and she'll just kind of tell you what that is ahead of time. And so for her today, she's going to go, she's just going to make that little noise for me, and then I'm going to stop, and then you'll see what I do after that. Okay? So first, I'm going to remind her, okay, go ahead and relax. I have your head completely in control, and I'm just going to kind of go to this side. Now, you don't move for me. I'm going to move you. Just relax. And I'm just going to kind of go directly to the side here until I hear her little noise, and I heard it there. Okay? I'm going to have her breathe in. And she's going to breathe out, and I'm just going to let her relax into that a little bit more. I'm going to count 1001, 1002, and then I'm going to come up. Now, don't help me coming up. I have complete control of your head. Now, it's really important that you do have complete control of their head because if you accidentally drop the head or make them feel like they're not supported, they're not going to relax as much and they're not going to get as much out of the stretch, okay? Now, we're going to go to the other side. Down we go. And she's going to let me know. And that was there right there. I ask her to breathe in and breathe out. And she relaxes in it a little bit more. Perfect. And I'm going to come up and you just relax. I'm coming up for you. Yep, just relax. The more you do this, the more your patient is going to be able to relax, okay? Or your family member, whoever you're helping this with, okay? Now we're going to go straight down. So again, I'm doing it for you, so you just relax, okay? Just relax, relax. And we're going down like this. Perfect. And when I feel like she's kind of at that place, I just kind of where she's has resistance there. I'm going to kind of go back like this and just kind of allow gravity to kind of pull on that. Now relax. Take a deep breath in and relax. And I'm just going to just ever so slightly just give it a little bit of pressure. She's going to make the noise if it bothers her. There's the noise. And I'm going to come up so you don't help me. And it should feel like a nice heavy head. If they're helping you, you can feel it in your fingers. Now we're going to go backwards, okay? And again, I'm going to support her the whole way. She doesn't feel like she's out of control at all. And there's the noise. And we're just going to let gravity just rest on that just a little bit more. And then I'm pulling her up. Perfect. Now this next one is the one that I find helps my patients the most. And it involves this muscle right here. I'm going to have you take control of your head again. Notice how I let her know that I'm not going to hold one side of it. So she's engaging her muscles and she's helping to hold it up, okay? This muscle right here, Okay, it's called the sternocleidomastoid. And for a lot of patients, this one helps to refer, if there's a little tension in there or a trigger point, it refers pain to headaches quite often for my patients. So we want to stretch that out. Now we got a little bit of it when we went directly to the side, but now we're just going to kind of tip the chin up just a little bit. So I have control of your head again, so you can relax. Perfect. So we're going to go over to the side initially, and then we're going to have her try to look behind her head a little bit. And she's going to relax. And there's the noise. Breathe in. Breathe out. Great. And I'm going to bring her back up again. Awesome. We're going to do the other side. Over to the other side. She's a little tighter on this side. I'm going to bring the chin up. Again, I'm not doing that by pressing on her mandible. I'm up here on her top of her head. And she's going to go, Good. Breathe in. Breathe out. Great. And I'm bringing her back up. Just relax. Let me do it for you. Perfect. So those are just a few stretches that are our most usual and customary that help our patients quite a bit. I'm going to go ahead and release control of your head. Are you ready? Okay. And off we go. One thing that I find helps patients kind of re-engage with their muscles is I hold my hand right here next to their cheek, and I ask her to look over her shoulder. Go ahead and look over your shoulder. Good. And relax. And the other way. Good. And relax. Okay? Now there's lots of other ways that we go about doing these stretches. We do it just how you saw now, okay, without any aids. All you need is a nice sturdy kitchen dining room table, or a chair that is, and a helper. Now, sometimes you don't have a helper, so you can kind of replicate these stretches on your own. But if you can find somebody that you trust that will help support you and hold your head well, it's a great way to really get all of the accessory muscles, the ones that are going to try and support and splint for the one that you're stretching and allow everything to relax. Okay? Thanks so much. If you have any other thoughts or questions, go to our website at tmjandsleepapnea.com.